A recent outbreak has raised serious concerns about public health safety. But here's where it gets controversial. 3 new measles cases have been linked to a single individual in Fulton County, sparking questions about how such outbreaks can occur in a state with robust healthcare systems. Let's break down what's happening and why this matters. Georgia health officials have confirmed 3 additional measles cases tied to a previously identified case in Fulton County. These new cases were classified as close contacts of the initial infection, which was confirmed on September 11th. Officials are investigating potential exposures at locations like Georgia State University, Sweetgreen on North Avenue, and soccer games hosted by Inter-Atlanta FC. 5 of these potential exposure sites are under active monitoring, though details about the individuals or specific locations remain unclear. 2 of the newly identified cases are unvaccinated, while the third's vaccination status is still unknown. All 3 are currently isolating at home to prevent further spread. As of Tuesday, authorities have identified 268 close contacts, with 7 under active surveillance. This brings Georgia's total measles cases this year to 10, a significant jump from the 6 reported in 2024. Measles is a highly contagious viral illness that starts with a runny nose, cough, and high fever before developing into a distinctive red rash. The rash typically appears 3 to 5 days after symptoms begin, spreading from the face down to the rest of the body. Fever spikes can reach over 104 degrees Fahrenheit, and complications like pneumonia, blindness, or even death are possible, especially in young children or those with weakened immune systems. Prevention is key. The MMR vaccine, protecting against measles, mumps, and rubella, is the most effective way to avoid infection. Children should receive their first dose between 12 and 15 months old, with a second dose between 4 and 6 years. Once infected, there is no cure, so early detection and isolation are critical. If you suspect measles or have been exposed, act quickly. Contact your healthcare provider immediately or call the Georgia Department of Public Health's Acute Disease Epidemiology Section at 404-657-2588 during business hours, or 1-866-PUB-HLTH after hours. If you're sick, stay home and avoid contact with others, especially infants or people with compromised immunity. What do you think? Is the current approach to tracking and preventing measles sufficient, or are there gaps in the system that need addressing? Share your thoughts in the comments below.